Hello everyone, I am Dr. Deepa. Today we are here to learn about the muscles of the pharynx. When we talk about the muscles of the muscles of the pharynx are categorized into two categories. Number one are the extrinsic muscle. Number one is the extrinsic muscle and number second is the intrinsic group of muscle. The extrinsic and the intrinsic group. These extrinsic group of muscle make up the outer circular layer of muscle. The extrinsic muscle make up the outer circular layer of muscle, whereas the intrinsic muscle make up the inner longitudinal group of muscle. The inner longitudinal group of muscle. So the outer extrinsic muscle are arranged in a circular manner, whereas intrinsic muscle are longitudinally arranged. These muscles are striated muscles. When we look on to the outer circular group of muscle, mainly include the three constrictors, that is the superior constrictor of the pharynx, the superior constrictor of the pharynx, the middle constrictor and the inferior constrictor. The middle constrictor and the inferior constrictor of the pharynx. So these are the three constrictors of the pharynx which make up the outer circular group of pharyngeal muscles. When we move on to the intrinsic muscle, that is the inner longitudinal muscles, they are again three in number. One is the stylopharyngeus muscle, the stylopharyngeus muscle, the salpingopharyngeus, the salpingopharyngeus muscle, and number third is the palatopharyngeus muscle, the palatopharyngeus muscle. So these are the three intrinsic muscles, the stylopharyngeus, the salpingopharyngeus and the palatopharyngeus. We will look on to the muscles one by one. This is the diagrammatic view where we can make out the arrangement of the three constrictor muscles as I have discussed, which are the extrinsic or the outer layer of muscles of the pharynx. Number one is the superior constrictor over here. Number second is the middle constrictor and number three is the inferior constrictor. So these are the circular layer of muscles. All these constrictor muscles, they are arranged circularly around the wall of the pharyngeal tube and they tend to have the common insertion behind in the median fibrous raphe. This median fibrous raphe, the median fibrous raphe is seen to extend from the pharyngeal tubercle which is present at the base of the skull, that is basi-occiput, to the pharyngoesophageal junction. Yes, the median fibrous raphe is the fibrous raphe which is seen to extend from the basi-occiput, that is the pharyngeal tubercle which is present at the basi-occiput, the pharyngeal tubercle, to the pharyngoesophageal junction, to the pharyngoesophageal junction. So this is the extent of the median fibrous raphe. So all these three extrinsic group of muscle, they take its origin from this different point of ligaments or maybe the bones, and they are arranged circularly around the pharyngeal tube to get inserted along the median fibrous raphe behind. Moving on to the very first muscle, that is the superior constrictor of the pharynx. The origin of this superior constrictor of the pharynx, the origin of the superior constrictor of the pharynx is mainly from the following points, that is number one is the posterior border of the medial pterygoid plate, the posterior border of the medial pterygoid plate. Number second is the pterygoid hamulus. The number second is the pterygoid hamulus. Number third is the posterior border of the raphe, that is pterygomandibular raphe, pterygomandibular raphe. And number four The origin is also from the posterior end. The origin is also from the posterior end of the mylohyoid line of the mandible. Mylohyoid line of the mandible. Few fibers are also seen to take its origin from the tongue. That is the side of the tongue. The side of the tongue as well. So these are the areas from where the fibers of the superior constrictor muscles takes its origin from. So I repeat, the origin of the superior constrictor muscle is from the medial pterygoid plate, that is the posterior end of the medial pterygoid plate. Then comes the pterygoid humulus, the pterygomandibular raphe, the mylohyoid line, the posterior end of the mylohyoid line, as well as the tongue also. So these are the 5 origins of the superior constrictor. So we can simply remember these 5 origin as the MP3. M stands for the mylohyoid line. P3 stands for the 3P's of origin, that is the medial pterygoid plate, the pterygoid humulus, as well as the pterygomandibular raphe. So pterygoid plate, pterygoid humulus, pterygomandibular raphe are the 3P's from where the origin of the superior constrictor takes place. And of course, there is a few fibers taking its origin from the posterior end of the or the side of the tongue also. So this is about the origin of the superior constrictor muscle. When we talk about the insertion of the superior constrictor muscle, the insertion of the superior constrictor muscle, as we can see, it is directed downwards, backwards and medially to reach the median fibrous raphe, which is present along the posterior aspect of the pharynx. And the highest fibers of this superior constrictor is seen to get inserted onto the pharyngeal tubercle. The highest fiber is seen to be inserted onto the pharyngeal tubercle, and later on the fibers are getting inserted onto the fibrous raphe below. This is the space which we can see here. We can just make out the space over here, between the uppermost margin of the superior constrictor muscle as well as the base of the skull. This space is called as the sinus of Morgagni. This space is called as sinus of Morgagni, which is the space present between the base of the skull and the upper border. It is a space present between the base of the skull here and the upper border of the superior constrictor muscle. So this is called as the sinus of Morgagni. Usually this space is closed by the two fascia, that is the buccopharyngeal fascia and the pharyngobasilar fascia, and also allows the passage of the sinus is important to be known because this sinus allows the passage of the tube, that is the auditory tube. It allows the passage of auditory tube through it. So that's all about the first external muscle, that is the superior constrictor. Moving on to the next muscle beneath the superior constrictor, which is called as the middle constrictor muscle. This middle constrictor is taking its origin. The middle constrictor is seen to take its origin from the hyoid bone, that is the upper surface of the greater cornu as well as the lesser cornu of the hyoid bone. The origin of the middle constrictor, in short, is mainly from the cornu of the hyoid bone, both the greater and the lesser cornu. And these fibers are again directed downwards, backwards and medially to get inserted onto the median fibrous raphe. Next, beneath the middle constrictor lies the lowermost external muscle, that is called as the inferior constrictor muscle. The inferior constrictor muscle is a bit different in this part, as this constrictor muscle has got two components, that is the thyropharyngeus muscle, which is seen here, and the cricopharyngeus muscle. So the inferior constrictor has got two parts, the thyropharyngeus and the cricopharyngeus part. The thyropharyngeal part of the inferior constrictor muscle is seen to arise from the oblique line and the inferior horn of the thyroid cartilage, as we can make out from here. This is the thyroid cartilage. The origin of this thyropharyngeal part of the inferior constrictor is from the oblique line of the thyroid cartilage. The cricopharyngeal part of the inferior constrictor take its origin from the cartilage, that is the anterior arch of the cricoid cartilage. So the thyropharyngeal part from the thyroid cartilage, the oblique line of the thyroid cartilage, and the cricopharyngeus from the anterior arch of the cricoid cartilage. So this is about the origin of the inferior constrictor muscle. The insertion of this muscle, inferior constrictor, is again backward onto the median fibrous raphe till the pharyngoesophageal junction, wherein the pharynx is seen continuing with the esophagus below at the lower border of the cricoid cartilage. So this is all about the three external group of muscle which are arranged circularly: the superior constrictor, the middle constrictor, and the inferior constrictor. Looking at these three constrictor muscle, we'll just observe that the arrangement of these three muscle is in such a way that close to the insertion, we can observe the constrictors are seen to overlap one another from below upward, as if the placing of three flower pots one within the other. So this is the arrangement. In this picture it is better visualized. The arrangement of the three constrictors, the superior, middle, and the inferior, is in such a fashion as if we place the flower pot one within the other. So this is the arrangement of the three constrictors of the pharynx. There is a space also which is present between the adjacent constrictor muscle. There are some structures passing between the constrictor muscle. We'll just look on to these structures. So this is the superior constrictor, the middle constrictor, and the inferior constrictor, and the base of the skull in the uppermost part. This is the pharyngeal tubercle, which gives attachment to the median fibrous raphe behind. The smaller spaces which are present between the three constrictor muscle allows the passage of certain important structures. That is the very first space, that is the space which lies between the base of the skull and the superior constrictor, the upper border of the superior constrictor muscle, which is called as the sinus of Morgagni, which is called as this space, which is called as the sinus space of Morgagni. This space allows the passage of the important tube, which is called as the auditory tube. So this sinus of Morgagni allows the passage of the auditory tube, number one. Second is the levator valli palatini muscle. Levator valli palatini muscle, the artery, that is the ascending palatine artery, and also the branch of the ascending pharyngeal artery also. So these are the important structures which is seen to pass through the space above, that is the sinus of Morgagni. The structures are the auditory tube or the pharyngotympanic tube, the levator valli palatini muscle, and the ascending pharyngeal artery, also the branch of the ascending pharyngeal artery also. So next is the space between the superior and the middle constrictor. This space between the superior and the middle constrictor allows the passage of one muscle and one nerve mainly. The muscle is the stylopharyngeus muscle, and the nerve accompanied by the stylopharyngeus, that is the glossopharyngeal nerve, the glossopharyngeal nerve. So these are the two structures passing between the superior and the middle constrictor. Moving on to the structures which lie between the middle and the inferior constrictor muscle are again the nerves and the vessels, that is the internal laryngeal nerve and the superior laryngeal artery. Internal laryngeal nerve and superior laryngeal artery are the structures passing between the middle and the inferior constrictor. Below the inferior constrictor lies the passage of the recurrent laryngeal nerve and the internal laryngeal artery. Recurrent laryngeal nerve and the internal laryngeal artery. So these are the structures passing between the constrictor muscle. The structures passing between the constrictor muscles. So beneath the base of the skull lies the auditory tube, the levator palatine muscle, the two arteries, that is ascending palatine and the branch of the ascending pharyngeal artery. Between the superior and the middle constrictor lies the muscle stylopharyngeus accompanied by the nerve glossopharyngeal. Between the middle and the inferior constrictor lies the internal laryngeal nerve with the superior laryngeal artery, and the area below the inferior constrictor is allowing the passage of the recurrent laryngeal nerve and the inferior laryngeal artery. So these are the structures between the constrictor group of muscles. One important thing which is to be noted here is the dehiscence, which is called as the Killian'S dehiscence. This Killian'S dehiscence is nothing but the weakest point along the constrictor group of muscles. The junction between the cricopharyngeus and the thyropharyngeal part of the inferior constrictor. The area between the thyropharyngeus and the cricopharyngeal part of the inferior constrictor is considered as the weakest part of the pharynx. This point is called as the weakest point of the pharynx. It is the weakest point of the pharynx because the area above the dehiscence is reinforced by all the three constrictor muscle, that is the thyropharyngeal part of the inferior constrictor muscle, the superior and the middle constrictor muscle, whereas the area below this point, that is below the thyropharyngeus, is supported only by the cricopharyngeal part of the inferior constrictor muscle. So the area above the dehiscence has got the maximum muscular support compared to the area beneath this, which is supported by the only cricopharyngeus muscle. Henceforth, this point acts as the weakest point of the pharynx, which is named as the Killian'S dehiscence. Next, moving on to the intrinsic muscles of the pharynx or the longitudinal group of muscles. The longitudinal group of muscles are again three in number, that is the palatopharyngeus coming from the soft palate, the salpingopharyngeus from these as tubal end, and the stylopharyngeus originating from the styloid process. So the three longitudinal group of muscle or the internal group of muscles are arranged longitudinally along the wall of the pharynx, and all these three muscles represent the common insertion along the free posterior border of the lamina of the thyroid cartilage. So the insertion of all these three muscles is common as a common aponeurosis along the posterior end or along the posterior border of the lamina of the thyroid cartilage. The first muscle, the stylopharyngeus, which is seen here, this stylopharyngeus arises from the medial surface of the base of the styloid process. The origin of the stylopharyngeus is from the medial surface of the base of the styloid process. This stylopharyngeus is accompanied by the nerve, that is the glossopharyngeal nerve, and later it is seen to get inserted onto the posterior border of the lamina of the thyroid cartilage. The palatopharyngeus muscle is taking its origin from the palatine aponeurosis. So the origin of this palatopharyngeus is a bit different here, as this palatopharyngeus muscle originates in the form of two fascicles. It arises in the form of two fascicles, that is the anterior and the posterior, anterior and the posterior fascicle. The origin is in the form of the anterior and the posterior fascicles from the upper surface of the palatine aponeurosis, and later this muscle, the two fascicles unite to make up a common muscle tendon which gets inserted onto the same point, that is the free posterior border of the thyroid lamina. Moving on to the third muscle, that is the salpingopharyngeus. The salpingopharyngeus arises from the lower part of the tubal elevation. It is seen to arise from the lower part of the tubal elevation, which is seen in the nasopharynx, and later this salpingopharyngeus is getting inserted over the common insertion, that is the thyroid cartilage. So this is about the three longitudinal or the intrinsic group of muscles. When we talk about the actions of all the three longitudinal muscles, they elevate the larynx and shorten the pharynx during the swallowing. So this is the action of the internal group of muscle. They bring about elevation of the larynx and shortening of the pharynx during swallowing. This is the atlas view where we can make out the three constrictors of the pharynx and also the longitudinal muscle, the stylopharyngeus over here. We can make out the glossopharyngeal nerve which has been discussed running along the course of the stylopharyngeus muscle, and also the nerves in relation to the constrictor muscle. So this is again the atlas picture where the lateral view is seen showing the muscle, the stylopharyngeus muscle over here. Then we can also make out the constrictor muscle. We can make out the superior constrictor as well. This is the picture of the pharyngeal wall from its posterior view. It is the posterior view of the pharynx where we can make out the median pharyngeal raphe, as I have already told, extending from the pharyngeal tubercle to the is pharyngoesophageal junction, and all the constrictor are seen to take its insertion onto this median fibrous raphe. This is the picture of the showing the deeper dissection of the pharynx, the lateral view, where we can just make out the three constrictor muscles of the pharynx, the superior constrictor over here, the middle constrictor and the inferior constrictor. We can also try to look onto the attachments of the superior constrictor, which is taking its origin from the pterygoid hamulus, the medial pterygoid plate and the pterygomandibular raphe, as I have mentioned. The three P's, that is the pterygoid hamulus, the medial pterygoid plate and the pterygomandibular raphe, and also the few fibers taking its origin from the mylohyoid line of the mandible. So this is about the constrictor muscles seen. This is the posterior view, which is representing the partially dissected area of the posterior wall of the pharynx, which has been opened up here, whereas we can make out the salpingopharyngeus muscle, which is seen over here extending from the auditory tube to the pharynx. This is the palatopharyngeus muscle and the stylopharyngeus muscle, all of which are seen. This is the posterior free border of the thyroid muscle, thyroid cartilage, where we can make out the insertion of all the three longitudinal group of muscles. This is again the atlas view showing the longitudinal group of muscle has been discussed. This is the palatopharyngeus muscle which is seen, and along with the other pharyngeal muscle, that is the salpingopharyngeus, all of which taking its insertion onto the posterior border of the thyroid cartilage, the lamina of the thyroid cartilage. So this is all about the muscles of the pharynx. All the muscles of the pharynx are supplied by the cranial part of the accessory nerve through the pharyngeal plexus, except one muscle, that is the stylopharyngeus, which is supplied by the glossopharyngeal nerve. So this is about the nerve supply. All the muscles except stylopharyngeus supplied by the cranial part of the accessory nerve via the pharyngeal plexus. So this is about the nerve supply of the pharynx. Thank you.